Pain catastrophizing is a term used to describe exaggerated negative thoughts and feelings about pain. But what does it really mean to catastrophize pain? Is every strong reaction to pain an overreaction, or could some responses be entirely normal? In this video, we'll explore the difference between typical negative responses to pain and true catastrophizing, and why context matters more than you might think. Let's start by understanding the basics of pain catastrophizing and why it's been such a hot topic in pain research. Catastrophizing has been defined as a maladaptive and exaggerated cognitive and emotional response to actual or anticipated pain. Some experts describe it as viewing pain as much worse than it actually is. But there's a catch. Pain is by definition an unpleasant experience, so some negative thoughts are expected. The real challenge is distinguishing between normal negative reactions and those that are truly out of proportion. This distinction is at the heart of ongoing debates in pain psychology. Measure pain catastrophizing. Researchers often use the Pain Catastrophizing Scale, or PCS. This 13-item questionnaire asks people to rate how often they have certain thoughts and feelings when they are in pain. However, the PCS doesn't specify which pain experience to consider, leaving it up to the respondent. This lack of context can make it hard to interpret scores accurately, as people may be thinking of very different types or intensities of pain when they answer. Imagine two people filling out the PCS. One is thinking about a stubbed toe, the other about a broken bone. Their responses will likely be very different even if both are honest. This is why context, especially the intensity and type of pain, matters so much when interpreting catastrophizing scores. Without knowing the referent pain, it's easy to misjudge whether someone's response is exaggerated or simply appropriate for their situation. Recent studies set out to clarify these issues by asking 228 adults to complete the PCS multiple times, each time considering a different pain scenario. These scenarios range from mild, a foot splinter, to moderate, striking your shin, to severe, slamming your hand in a door. By comparing responses across these scenarios, researchers hope to better understand what counts as high catastrophizing and how much context influences scores. Participants were asked to imagine 3 specific pain scenarios: getting a splinter in the foot, mild pain; hitting their shin on a table, moderate pain; and having a car door slammed on their hand, severe pain. For each scenario, they rated the anticipated pain intensity and then completed the PCS. This approach allowed researchers to see how catastrophizing scores changed depending on the pain context. One key finding was that people's tendency to catastrophize was fairly consistent across different pain scenarios. In other words, if someone scored high on the PCS in one situation, they tended to score high in others as well. This suggests that catastrophizing has a trait component. Some people are simply more prone to negative thoughts about pain, regardless of the situation. Despite this consistency, the actual PCS scores did vary depending on the pain scenario. Catastrophizing scores were generally higher for more intense pain scenarios. For example, the average PCS score for the severe pain scenario was much higher than for the mild one. This means that the same PCS score could be considered normal in one context but exaggerated in another. So how do we decide when a PCS score is truly high or exaggerated? The study used the 75th percentile of scores for each pain intensity as a threshold. This means that what counts as high catastrophizing depends on the pain context. For mild pain, a lower PCS score might be considered high, while for severe pain, a much higher score would be needed to qualify as exaggerated. Many studies use a single cutoff score on the PCS to define high catastrophizing, but this approach can be misleading. Because people consider different types and intensities of pain when answering, a fixed cutoff doesn't account for context. This can lead to over or underestimating how much someone is catastrophizing, making it hard to compare results across studies or individuals. Study found that about 40% of the variation in PCS scores could be explained by the intensity of the pain scenario. In other words, as pain intensity increased, so did catastrophizing scores. This relationship was strong but not absolute. Other factors also played a role, such as individual differences and emotional traits. Not everyone responds to pain in the same way. The study found that people who had experienced higher levels of pain in the past tended to catastrophize less in response to new pain scenarios. Emotional traits like negative affect and sensitivity to bodily sensations also influence PCS scores. This highlights the importance of considering personal history and emotional makeup when interpreting catastrophe. PCS includes 3 subscales: rumination, magnification, and helplessness. The study found that pain intensity had the strongest effect on rumination, followed by helplessness and then magnification. This means that certain negative thoughts, like dwelling on pain, are more sensitive to pain intensity than others. While pain intensity is important, it's not the only factor that influences catastrophizing. The type of pain, whether it's acute or chronic, and other characteristics like unpredictability or previous experiences, can also affect how people think and feel about pain. The study focused on acute pain scenarios, but future research may need to consider these other dimensions for a more complete picture. Interestingly, there's no clear vocabulary for the opposite of catastrophizing, or for describing average negative responses to pain. Not all negative thoughts are exaggerated or pathological. Sometimes, they're a normal reaction to a difficult experience. This lack of nuanced language can make it harder to communicate about pain and its psychological impact. Labeling someone as a catastrophizer can be stigmatizing, especially if their response is actually appropriate for the pain they're experiencing. Some researchers have suggested renaming the PCS as a measure of pain-related worry or distress, rather than catastrophizing. This shift could help reduce stigma and encourage more accurate, compassionate assessment. Understanding the context of pain catastrophizing has real-world implications. For example, interventions might target negative thoughts even if they're not technically exaggerated, just as we treat inflammation after an injury regardless of whether it's abnormal. Recognizing the full range of responses to pain can help tailor treatments and improve outcomes for people in pain. Like all research, this study had its limitations. The scenarios were based on acute pain and may not apply to chronic or unexplained pain. The sample was mostly young, healthy adults from a university community, so results might not generalize to other populations. Still, the findings offer important insights into how we interpret and use catastrophizing scores. Main takeaway from this research is clear. We need to consider the context, especially pain intensity, when interpreting pain catastrophizing scores. Fixed cutoffs are not enough. By anchoring scores to specific pain scenarios, we can better identify when negative thoughts are truly exaggerated and when they're simply a normal part of the pain experience. Future research should explore other pain characteristics, such as chronicity, unpredictability, and type, to further refine our understanding of catastrophizing. Developing better vocabulary and assessment tools will help clinicians and researchers distinguish between normal and exaggerated responses, leading to more effective and compassionate care. Summary: pain catastrophizing is a complex, context-dependent phenomenon. Not all negative thoughts about pain are exaggerated, and interpreting PCS scores requires careful consideration of the pain scenario. By moving beyond fixed cutoffs and embracing a more nuanced approach, we can better support people dealing with pain and avoid unnecessary stigma. Thanks for joining us on this exploration of pain catastrophizing, where context is key.